And I am here for my Facebook Live with all of you beautiful cat parents, cat guardians, cat owners, cat lovers, whatever you are. I am glad that you're here. So it often takes a little bit for people to jump on. So while we're waiting, I can just tell you a little bit about myself. Veterinarian, right? Veterinarian, got this sign, practiced for 16 years, graduated from UC Davis, and I practiced in both California and Colorado. And I always used to joke with people because I am licensed for all treatment of all non-human animals, but I always say if you liked or loved any animal that you had that was not a cat or a dog, that you would probably take them to see somebody else because my expertise is in cats and dogs. Practiced for 16 years. I also did some shelter medicine, and now I do things like this. And so I see that people are starting to pop on here. Hello, welcome, welcome, welcome. This is my hour that I have dedicated to you and your cat and your hi. Oh my God, Cyber Rats, you're back. Hi, you guys got out of school. I'm so glad you're here. So hi, everybody. I am excited to see that you guys are showing up. So, oh, Brooke Lane, very impressed with your education. Well, thank you. It was very expensive and took a long time. And hopefully I can help you with some of the things that I'm saying here. So, all right. So here's the deal, my friends. I am here to answer your questions. So if you have a question, I recommend popping it in the chat section as soon as possible, because what happens is the chat section gets you guys are so funny. The chat section gets a little bogged down with questions, and oftentimes I'm not able to get to all of them. I'm reading through your stuff that you guys are writing already. So if you have questions, ask them for me immediately, okay? And I am going to just launch into this so that you guys can be inspired by the questions that are being asked and maybe get some knowledge from what has been asked, okay? So here's a question. My sister's dog has worms and is getting treated soon. How do I know if my cat has them or not? Great question. Wonderful question. I always appreciate everything you have to say, Cyber Brats. So obviously, we are concerned about getting intestinal parasites, not only in our pets, but some of them are transmissible to people. Yes, we can get hookworms, we can get roundworms, we can get tapeworms. So if your sister's dog is getting treated for worms, I don't know if your cat has been exposed to the same worms. I also don't know what kind of worms they are. So if I see you pop up again in the chat with the type of worms, I can give you more information. Having said that, cats and dogs are infected with most intestinal parasites. So your main ones, your hookworms, roundworms, and whipworms are kind of the main intestinal parasites. And then you got tapeworms over here. I'm going to put tapeworms over there. There they are, over there, because they transmit a little bit different way. So hookworms, roundworms, whipworms, those are all what we call, this is going to sound gross, but here we go, a fecal oral route. Oh, it's disgusting. So what happens is the cat or the dog, or sometimes the human, accidentally ingests parasite eggs into their body. Eggs hatch, boom, you have worms. So the cat has to be exposed to the eggs, either in a piece of poo, ew, or sometimes through eating eating dead things. So if your animal is a big hunter, then they're at higher risk for worms because a lot of wild animals have worms. They just do. And I said I put tapeworms way over here because tapeworms just had to be different, didn't they? They have to be different. So tapeworms are not transmitted fecal oral route. They require fleas as part of their life cycle. Yes. So a flea, an animal has to either eat another animal that has tapeworms, they can get infected that way, or more commonly, they groom a flea off of themselves that has been infected with tapeworms, and then they get infected. Now, if those tapeworms come out the other end. Yes, I know this is really gross, and I'm sorry we're starting with this, but if the tapeworm segments come out the other end, out of the butt, those are not considered infectious because they have to go back through a flea in order to develop. So that's kind of the skinny on the four main worms that we see in these animals. I would say the only way to know if your cat has worms is to have their poo tested. So, and that's not 100%. Sometimes it's a false negative because intestinal parasites aren't shedding eggs all the time. And so when you take the poop to the veterinarian and you give it to them and then they take it in the back, what are they doing with it, right? Well, they take it, they make a stew with some solution, and then sometimes they spin it in a spinner, and then they take it and they put it on a slide and they look for eggs. And then if they see eggs, then they say, well, your animal has worms. Now, sometimes we don't see the eggs because, again, these parasites don't shed all the time. In that case, we often just deworm them just in case because some of these worms are transmissible to humans. So you could hear your veterinarian say, well, I didn't see anything in the poop, but we're going to deworm anyways. That's your veterinarian literally. That's how we cover our ass because we don't always see the eggs. And the last thing we want to do is let that animal go home and potentially be infected, especially if your household has children, right? Which are more likely to stick things in their mouth. Yes, I know this is gross, but that's why we do that. Okay. So the only way to know is to get the poop tested. And then if you're worried in any ways, dewormer is cheap. At least it used to be before ivermectin was the most popular drug on the planet, apparently. So, and you can often get it over the counter, right? So if you're worried, you can often go to just a feed store and get some dewormer for your cat. All right. I feel like I've talked about that a lot. So, hello. Oh my gosh, we have people from the UK here. Hello from my cats here in the UK. Hello. Okay, then we have this person here. I'm a new cat mom. I'm happy to be here. I'm happy you're here too. Thank you for coming. Okay. So here is a question about a stray cat from this person. I apologize. I feel like I'm going to butcher this name, so I'm not even going to try to say it, my friend. There's a stray cat that comes to visit me every night. I'm not sure if she has an owner or not. I don't have a lot of money, but I see she has a few cuts and scratches. How can I help her out? Well, I'm not sure where you're coming from. I'm not sure if you're in the States or if you're someplace else. So often with cuts and scrapes on cats, you often don't have to do much with them. So there's an old saying that if you throw a cat together in the same room with their bones, they will heal. And we don't know why cats are such remarkable healers. Maybe it's because they groom themselves. Maybe it's the frequency of the purr, which can be healing. But they're very good healers. And so if you're noticing cuts and scrapes, it could be that this cat is fighting, right, with other cats. And it could continue to get cuts and scrapes from that. I don't know. I'm just guessing. The challenge with that, my friend, is that cats that have these cuts and scrapes all over them, especially if they're a intact male cat, which means that they still have their testicles, those cats, unfortunately, the stray ones are often, at least in the States, infected with one of two diseases, usually FIV, feline immunodeficiency virus. And then they're often infected with feline leukemia as well. And those are both viruses. The problem is these cats can often serve as reservoirs to infect other cats. And so if you're noticing this cat and you're seeing that the cat isn't in the best condition, if you have animal control in your area, I highly encourage you to call them. And what they will do is they will take the cat and they will test the cat and they will treat the cat if the cat can be treated. And they will take the cat out of the environment in case that cat does have those viruses, and it will make it less likely to spread the viruses to other cats. And this is probably not what you want to hear, but in my experience, most of these male cats, the ones that are fighting, come in and do have some level of FIV. And it's sad, but it's true. So if I were you and you're seeing this kind of on this kitty, and there could be other stuff going on too, right? I mean, worms, like we were just talking about, scabies, ringworm, some of these things are infectious to humans. So I would definitely call your local authorities and get that cat in and seen by a veterinarian. Okay? Don't attempt to really treat the cat yourself. I don't know how successful you will be, and I don't want you to put yourself at risk. Okay? Okay. All right. How about well, this is an interesting question. I'm traveling with my cats and they're getting used. Used to it? Maybe? I'm not sure what you're asking. Is it good for them? Oh, okay. Well, you may not be able to travel control your environment, and maybe you are traveling nomad. Cats are adaptable as long as they know what to expect. So in general, cats don't love it when you change their routine. So if you are traveling with them, make sure that you can stick to routine as much as possible to try and avoid stressing them out. Also, utilize things that can help them be calm. Make sure they each have their own resources, their own bedding, their own food bowls, their own um, things like that, right? And make sure that you are giving them enough space, right? If you're traveling, then it suggests that you're probably outdoors with them a lot. So make sure that you have a way to keep them from being able to run off, keep them safe. And again, I mean, cats have been hanging out with us for 10,000 years. I'm sure in that time period, there's been a lot of cats traveling with a lot of people. So if they're healthy and happy, I don't have a problem with it. Make sure also that you know in the places that you're traveling to what, if any, disease risks there are in those areas, because some places have different diseases than others, right? So just look ahead, be prepared, but I wish you good luck on your adventure. For sure. Okay, here's some more about this. Here's some more about these feral cats and FIV. So we have Beth. Beth, the words are very small. I apologize. So Beth adopted a feral and he is FIV positive. He's doing great. Awesome. So the thing about FIV positive cats that if you keep, they can make wonderful pets. Feline immunodeficiency virus is the disease we're talking about. They can make wonderful pets. They can stay healthy for a long, long time. If you do have one, it's best to have them in only a single cat household, or all animals need to be FIV positive so you're not spreading stuff around, right? But a healthy food for him, oh my gosh, there's so many that are out there. So if you go to my website, there's a couple of recommendations there at drsarahwooten.com. One of the companies I've worked with for a long, long time, it's a tiny little company called Life's Abundance. They make a phenomenal food. Their dry food's really, really good. I recommend feeding a combination of canned and dry. The only problem is dun dun dun, COVID. They don't have any canned food right now. So any canned food is good. I would do a combination of both. I wouldn't do just dry at all. I would do both. And make sure that your canned food is mostly just meat and water. Meat and water. You want something that is high in antioxidants. You want something that's high in omega-3 fatty acids. And those are the things that are going to help your sweet little kitty do really well and keep his immune system boosted. The other thing with FIV cats, it's really important to make sure that they're not stressed out. So the thing is, make sure that they're in a single cat family household. Don't go outside. And I'm so glad that this is working out for you. Okay, here is a question about welactin for dandruff. And by the way, sometimes when I get stumped, I pull out my books, right? My veterinary books. And so this person has a black cat with dandruff. Oh no, that's the worst color for dandruff, because dandruff is white and your cat is black, right? So obviously it's definitely very, very obvious. Okay, so, and I am looking in my book right now to help you out. So, Welactin is just omega-3 fatty acids, and it's an excellent supplement, but it sounds like your cat's got something else going on, and there's several different things that can cause dandruff or seborrhea in cats. I'm going to find a picture of maybe something. Let's see what we can find here. Talk amongst yourselves, my friends. So seborrhea is any time where the dead skin off of the back of an animal or a person, my head, it's accumulating and it's not coming off because the cat isn't grooming it off enough, something like that. And it can have several different causes. So some cats may have excessive seborrhea or excessive dandruff because they have autoimmune disorders. They could have cornification defects that just make it so that they tend to have more dandruff that comes off. There are some dandruff shampoos that you can use. Don't use tar on a cat. That is not a good thing to use on a cat because it's toxic. But there are other feline specific shampoos. I know you're like, I don't want to bathe my cat. What the heck, Dr. Wooten? Don't make me do that. But there are several shampoos that you could try. Also, there are some infectious diseases that look like dandruff. I'm not saying that this is what's going on in your particular situation, but there's actually a disease out there called walking dandruff. Right? Chilatiella is a mite that's so big that it looks like a piece of dandruff that's walking down the back of an animal. Isn't that crazy? So that could be what's going on, but probably not. What I'm suspecting is that you may need to add in a dandruff shampoo that is, as long as you have ruled out any kind of infectious causes, you may need to add in a dandruff shampoo. You also may need to just make sure that the cat is healthy otherwise, because cats, when they don't feel healthy for any particular reason, they'll stop grooming as much and then dandruff will accumulate. Also, there's some hormonal conditions that can affect dandruff, thyroid disorders, adrenal gland disorders. I've seen excessive dandruff in cats with diabetes. So making sure your cat has a clean bill of health underneath it. Also, you've got to give a welactin enough time to work. So the skin, their skin, our skin takes about anywhere from 6 to 10 weeks to turn over. And so you have to continue to give omega-3 fatty acids for that period of time. I would say a minimum of 10 weeks to see if it's going to help. Also, make sure you're doing the right dosage. Sometimes the dosage isn't quite high enough, and so you don't get high enough accumulation in the bloodstream. So hopefully that will help you out. Talk to your veterinarian about a prescription seborrhea shampoo. And then when you do use the seborrhea shampoo, here's even the more fun part. It has to stay on the cat for 5 to 10 minutes before you rinse it. Yeah, so you're going to definitely want to be Googling how to bathe a cat. Okay, but make sure the cat's doing well otherwise. Okay, here we go. Here's another skin one. My cat gets scabs very often because she licks her legs a lot when they're itchy. Have you ever heard of something like this before? I haven't. Well, yes, I have. I have definitely heard of this before. So one of the main things, since we're on the derm train here, I will show you guys a picture of something called miliary dermatitis. Miliary dermatitis. And it's what cats tend to do when they have an allergy and then they get itchy. There it is, 4 to 5. Hold, please. I'm going to get you a picture. So miliary dermatitis. Maybe they don't have a picture in here. Now I feel like I'm promising things I can't. So basically what it looks like. Ooh, that's gross. Can you see this? Can you see any of this? Oh, I'm terrible at this. I apologize, guys. There we go. Here we go. Okay, so when cats have allergies, they get little bumps and scabs all over their body, right? And so when you pet them, you'll feel bumps and scabs. and you'll see the scabs, and they happen everywhere. And so what is going on is they're just having an allergic reaction, and that's what their skin does. The most common allergies in cats are flea allergy, and then there is atopy, and then there is food allergy. And sometimes cats can have all three at the same time. And what happens with the cats with a flea allergy is they get bit by one flea. And in fact, it can be a roving flea, right? It jumps on it, bites them, it jumps off, you never see the fleas again. But then the cat gets all bumpy, right? So that's one of the main things that we see with these itchy cats. Atopy is just environmental allergies where they're allergic to something in their environment, like pollen or mold or dust mites or fill in the blank. Same thing that we're allergic to. They can also develop a miliary dermatitis. And then much less common, but still seen, is ingredient sensitivities or food allergies, where they're allergic to a protein, usually a protein that is in their food. The most common ones are the most common ones that are used: chicken, beef, soy, dairy, eggs, lower down pork, and then low corn and wheat, right? I mean, corn and wheat's got its own list of things that we might not like for animals, but food allergies tend to not be one of those things. It tends to be one of the common proteins that you see. And the difference between all of these is they can look the same in how they manifest on the cat, but a flea allergy usually only happens during flea season. Atopy only happens whenever that allergen is around. Food allergy year round. So if you were coming to see me and I saw your cat, I would look for fleas. I would comb your fleas. I would comb the fleas. So I would comb the cat looking for fleas. And I would look for flea dirt. And then I would probably treat the cat. I may treat the cat with some steroids and antibiotics to stop the itch and stop any infection, and then send you home on some flea control and tell you have to treat every single animal in the household. Otherwise, this cat's going to get reinfested, and then boom, you're going to be right back. Okay. If it was an inhalant allergy, I would talk to you about something like Apoquel, or I have even used cyclosporin in cats, off-label. I would talk to you about antihistamines. I would talk to you like Benadryl. I would talk to you about allergy shampoos. If it was a food allergy or a suspected food allergy, and oftentimes I attack all of these at the same time, by the way, I would ask you to change your cat's food, and I would put your cat on a food diet trial. And what that requires is 8 to 10 weeks. And remember, this is how long the skin takes to turn over. Okay, so you got to go for a long time. 8 to 10 weeks on either a novel protein, a protein your cat has never been exposed to before, or a hydrolyzed protein diet. And these are usually prescription therapeutic diets. But it's the same thing as if you went into the dermatologist and they thought you had a food allergy, and then they'd say, no dairy, no eggs, no soy, no fun, right? That's what they say. But it's kind of the same thing for your cat. And then your cat can eat nothing else. And then if all the symptoms go away in 8 to 10 weeks, boom, you've got a food allergy. Okay, great. You can either stay on the food or you can go back and challenge the cat to see if the symptoms come back. I'm not surprised most owners never want to do that. They just want their cats to be not itchy. Okay. Other possibilities that this could be a contact sensitivity. So maybe there is a detergent that you're using on the bedding that is causing them to have a reaction, in which case I would switch to hypoallergenic detergents. Could be some other kind of infectious issue. Scabies, Demodex, fleas. We talked about fleas. Could be hormonal. Could be stress. Cats can barber themselves. They can pull all their hair out when they're stressed. I don't know. So it's important for you to see a veterinarian so that they can do a couple of tests and find out what is going on. First of all, you need to know what's going on. And then second of all, treat it. So likely they'll do a skin scraping to look for any kind of parasites. If they suspect anything that's going on under the hood, they may recommend some blood work. right? But that is kind of my basic rundown to you, and honestly verbatim what I tell people in exam rooms all the time. So it is a little bit of trial and error trying to figure out what it is that is causing your cat to do this, but there's something. And so getting a vet in your corner to help you figure it out, very helpful. Okay. Okay, here we go. Here we go. Let's take a look. Oh no. Oh gosh. Okay. Okay, is there anything that can be done to treat a cat with bladder stones besides a medical diet? And when she says medical diet, I think she means what we're talking about with those prescription diets, those therapeutic diets. And yeah, cats can have really strong food preferences. So my cat will not eat the prescription medical food at all. Is there a pill of some sort? And my answer to you is maybe. Okay, so cats get several different types of stones. The most common are struvite stones. Struvite stones are typically associated with a urinary tract infection, but sometimes they're not. And then there's calcium oxalate stones. Those are not associated with a urinary tract infection, though sometimes they are, but they're not caused by a urinary tract infection. And then there's other kinds of stones, but I'm not going to go into them because they're a lot less common. So typically what I was doing is I would see these cats in and I would throw them on a diet called SO. And that's just what I was doing at the time. So SO causes cats to drink more because it's important for them to have more dilute urine so that they can dissolve stones. And then it changes the pH of the urine because stones only form in certain types of pHs. If the urine is too acidic or too basic, then boom, chemistry, you get crystals. Crystals clump together, become stones. So you could talk to your veterinarian and say, hey, doctor, I cannot get this cat to eat this food. What the heck can I do? So your doctor may not be happy with that because, we like our stuff and we like things to go this way, but they may suggest to you maybe just feeding the cat a canned diet because the water is so important. They may suggest testing your cat at home with pH strips to make sure that the urine stays within a certain pH. I've seen that done before as well. Or they may have a totally different solution. Again, treatment for struvite stones and treatment for calcium oxalate stones and treatment for all the other stones is different depending on what kind of stones they are. So if you are running into this problem, then it's time to talk to your vet. The other thing is maybe you can trick your cat into eating this new diet by really slowly mixing it. So I'm hoping they gave you a combination of canned and dry because most cats should be fed a combination of canned and dry. So maybe what you can do is you can really slow, like over 3 weeks, be really slow about mixing the new food in, right? Or maybe you mix it with some broth or something that your cat really, really likes. I don't know. But again, it depends on the type of stone. And then maybe if the cat's rejecting the food, you could also try warming the food up if it's canned food. But again, if you are not getting anywhere, try mixing the food with the old food and then go really, really slow and see if you can't trick the cat over a couple weeks. Otherwise, go back to the drawing board, go back to the vet and say, this is not working. I need a different solution. Okay. Because there are other solutions out there. Okay. But I can't give you that much more without actually being your doctor. Wish I was. Okay. Here is a great question by another beautiful, wonderful cat enthusiast. My cat has long hair and I have a hard time telling what weight I should keep her at. I don't know if she's too skinny or too large. Great question. How do you know? So the easiest way I find to know is to do what I call the hand test. Hand test. So feel your cat's ribs. So when you're looking at your cat from the side, your cat's ribs are right behind the front legs and you can feel them. Okay. They feel like a little washboard. So feel them. And then if they feel like the back of your hand, that cat is at an appropriate weight. This is just an easy general way to do it at home, okay? So if the ribs feel like the back of your hand, you're fine. If you can't feel the ribs, or if they feel like the front of your hand and you just are like, where are these ribs? I can't feel them. Too fat. Okay. If the ribs stick out or feel like your knuckle, too skinny. Okay. So that is a general way to determine. The other thing, obviously, is ask your vet, because they can actually tell you exactly what weight your cat should be. And they can also evaluate your cat's muscle mass, which is really important because muscle is the foundation for metabolism. And so we can often have a lot of skinny, fat cats that don't have a lot of muscle. They're skinny, but they don't have a lot of muscle. So, but that's the easy way, is to do the hand test. All right. How can I get my cat to not poop, vomit, and carrier when going to the vet? Oh, honey, I'm so sorry. So, a couple of things that cats pooping and vomiting in the carrier because of stress, and there could also be some nausea. So, in those cases, I would talk to your veterinarian about getting a short-term anxiety medicine that you give to the cat about an hour before you put them in the carrier. And if it was my patient, I would put you on a little bit of gabapentin. Not you, your cat. But I would do some gabapentin because it's a beautiful muscle relaxant. It just makes cats super happy. The other thing I would do is I would leave the carrier open around the house and put in some treats, some maybe a t-shirt that smells like you, some things that the cat's likes. You could feed the cat in there. Just leave it open and let the cat go in and out all the time. So the cat becomes habituated to going inside and out of the carrier. And then once the cat is actually comfortable with the carrier, then you can, shut the door for short periods of time. Make it very positive. If your cat acts scared at all, stop. And then if that seems to be going well, you could pick the carrier up. You see where I'm going with this? And slowly get your cat used to it. So I would recommend getting some anxiety medication for the trips to the vet. We all need anxiety medication for going to the vet, let me tell you. And then if there is nausea, because it could be some nausea as well, motion sickness, cats get motion sickness just like dogs. You could talk to them about some Cerenia, which is a anti-nausea medication. Okay. So those are some of my ideas. Also, people don't think about this often, but when you put the cat in the car, unless you're putting them on a flat part, if you're putting them on a chair, then the carrier is usually tilted. And that really stresses cats out. So just roll a towel up and stick it underneath the carrier so it's flat. Make sure you're treating anxiety with medication. Make sure you are treating any nausea. Also, one more tip for you, get some Feel Away. Feel Away is a pheromone. It comes in wipes, sprays, diffusers. I would get the wipe and just wipe the carrier down with some Feel Away, because that's designed to release some feel-good hormones in your cat's brain. Hopefully those together will get you on the road to a happier crate experience with your cats. Oh, all right. Live, chill life. Why does my cat paw at the wall tub dresser? It's just one paw repeatedly. I don't know. I don't know. Okay, maybe there's a ghost. Maybe there's an obsessive compulsive, we can't say, we could say an obsessive disorder. Maybe you've got a rat or something behind there. I don't know. But I thought this question was great. If you're super concerned about it, typically what I say to people, because I'll get these questions all the time at the vet hospital, and I'll go, I don't know. But then if the person takes a video of it and shows me, and then I can go, oh, that's what that is. So take a video and show it to your veterinarian or a veterinary friend or a veterinary technician and see if they can help you. I'm sorry, I can't be more help on this particular question. Okay. Wow, this one's interesting. You guys are interesting. I like you. I adopted a kitten from the cat rescue. She is adorable, but she suckles on her own belly at night. Yeah, she does. Is there any way to stop this behavior? Well, one thing you could do is you could put You could put something that doesn't taste very good on the belly. Um, and that is some sort of deterrent. You could use like a little bit of bitter apple is a common one that people use. Just put a little bit down there. Also, take a look at her belly. Make sure that she isn't creating any kind of sores or anything down there. You could put a t-shirt on her, teeny tiny t-shirt. You could try some of the feel away that I talked about. So feel away is a pheromone, and it is the same pheromone that mother cats release when they are nursing their kittens. So your kitten is doing this because it's releasing feel-good hormones in the brain. So you've got to be able to do something else to help this kitten feel good, because they're doing it because it feels good. My dog used to lick the carpet because it felt good, right? The animals do the weirdest things. So I talked about a couple deterrents. You can try using the Feel Away diffuser or a spray around the area where your kitten is at night. That might be enough to help your cat just feel good enough. You could do some play before bedtime and see if you can't burn off some excessive energy. Those are a couple of different thoughts that I have to start. Your kitten may grow out of this behavior, or they may want to keep doing it for the rest of their life. And if it's not actually causing any problems and it's just more of a conversation piece, sometimes I say, what's the harm, right? If it's not causing any harm, why do we stop them from doing it if it makes them feel better, right? They could be doing it out of some anxiety, in which case a thunder shirt might be a really good option for you. That would bar access to the area where they're licking and provide that calming, comforting feel that thunder shirts provide. So those are a couple suggestions for you. See if that will get you started. Okay. Here's a shedding question. My cat seems to shed a lot, and she's a Turkish van cat. Turkish van cat. Hold on, I'm gonna look that up because, guys, I am not up on all the new the breeds. So let's. Oh, here we go. Oh, how pretty! Beautiful. Okay, beautiful cat from Turkey, obviously. So let's get back to you guys. Okay, so shed control treats. What do I think? I think it's worth a try. So if your cat's shedding a lot, but you're not seeing any actual baldness, then that is just your typical cat. That is your cat's pattern. You could try the shed control treats. You could try adding in the omega-3 fatty acids like the welactin that we talked about at the beginning of this video. Sometimes animals shed too much if they are lacking certain nutrients. You could also brush the cat daily. Or if the cat's cool, some cats are cool with being vacuumed with the little hand vacuums. That's crazy when they are cool with that, but that's another thing. So brushing daily would be a thing. And then, yeah, I would say try these shed control treats and come back and tell me if they work, because I need to know, right? Okay, next question. Can you inform us of the benefits of neutering and the ideal age to neuter male cats? Sure, I can. So neutering is basically when we surgically remove the testicles in a male cat, and in the female cat, we remove the ovaries and the uterus. And so the benefits of neutering, let's just talk about male cats, shall we? I mean, in female cats, your main benefits are you reduce the risk of the cat getting pregnant or developing any kind of ovarian cancer, breast cancer, or uterine infections. In male cats, and it doesn't really change the way they behave that much, where neutering male cats really does change their behavior. So male cats that have not been neutered, there's a couple of things that they have that make them a little bit more, it makes people want to neuter them more. Adult male cats have a very interesting odor, very strong. They also are more likely to roam and look for females, and they are more likely to fight and get certain infections from fighting. They're also very loud, and they start this call where they are calling for a mate, and it's loud. They are also, they spray urine, which is annoying, right? To humans, they think it's great. We're like, no. They're like, yes. So there's a lot of things that if you neuter a cat, you don't have those issues. The ideal time to neuter a cat, so if you were talking to me as just your doctor, I would say 6 months of age. 6 months is typically when we do it. You can do it sooner. You can do it later. If you do it sooner, there's not really very much risk. If you do it later, you run the risk of them developing those behaviors that a lot of humans find undesirable. So 6 months is generally when I would neuter cats. Okay, here's a long question about introducing new cats. Hi, I got a new ragdoll kitten 5 days ago. Congratulations, new kitten mom. How long will it take for my residential 1-year-old cat to get used to him? Kitten has his own based camp. Good. And they have not seen each other yet. Good. So I would say that it can happen right away or it could never happen. So cats they have their things that they like, they have their ways. And some cats will never integrate with new cats when they come in, and other cats will. So, to get the best success of doing it, you're doing the right thing. You don't have them together, you have them separate. I would take 3 weeks to introduce them. I would do a week where the kitten is confined to a small area, maybe a bathroom or a bedroom with all their own resources. And there's a door in between, and they can smell each other. And that's about it. And then I would change it to where they can have visual access of each other the next week and see how that goes. If that goes really well, then the next week there would be maybe some short supervised visits of the kitten coming out. Make sure your older cat has their own resources, has a place where they can get away. There's lots of vertical space, and try to not interfere and try not to force them. You cannot force cats to be friends. If your older cat does not want any interaction and wants to leave, let your older cat do that. It may take a long time. It may take 6 months. It may take 3 days. But the slower you go, the higher likelihood you are to have success getting these two cats to live together. And again, you can grease the wheel with some of that feel away. I mean, I swear to God, at this point, I should probably have a stake in the company or something. I don't. I wish. Okay, let's keep going here. Okay. My female cat, 1 year, 5 months old, has been crying out loud at night and keeps licking her private area. Even saw a pink discharge once or twice. Twice. Is it a UTI? Could be. Could be a UTI. Could also be something called feline interstitial cystitis or feline neurologic syndrome. It's got a lot of names. In women, it's called stress cystitis. Yes, women share this same condition with cats, but female cats in particular are susceptible to getting bladder inflammation that could include bloody urine that is due to stress. So stress cystitis could be a thing. And yes, it could also be a UTI. So if you're seeing that, it's the best to get a vet involved because it's obviously painful. She may not need antibiotics, but she's definitely going to need some pain meds. And if it is stress cystitis, she's going to probably need some more than that. So, yes, here I am on the internet and I am saying could be UTI, could be stress cystitis, could be something else. So, they also get vaginitis, which is inflammation of the vagina. I've talked about all the things today, haven't I? So, talk to your local vet. If you can't get your cat in, sometimes people will even just bring in a sample of urine. It has to be fresh sample of urine, but get that cat some veterinary attention. Get these some veterinary attention. Can I use Miralax for a constipated cat, or should I keep using lactulose? You hear me? Do you hear me typing? Because I'm typing how much. Yes, you can. So you can use Miralax. So Miralax is it's a laxative, and it works by pulling water into the the intestines. And so if you do give Miralax, you want to make sure that cat is drinking lots of fresh water. And you can pick up Miralax over the counter and you can mix it with canned food. Always check with your veterinarian first. But I use like 1/8 of a teaspoon every 12 to 24 hours. If I don't see any improvement, then I increase it up to anywhere like 1/3 or a 1/2 teaspoon. But as soon as I get runny stool, I know I've gone too far. Okay, so yes, you can check with your veterinarian first because they may have other reasons why they've stuck your cat on lactulose versus Miralax. Hopefully that's helpful. Okay, question. Is it too late for my kitten to get her shots? She is 4 months old and she hasn't got her shots yet. It's a beautiful question. Thank you so much for asking. No, it's not too late. Yay! So the only thing that'll be different is your kitten will only receive 2 boosters of most of the vaccines instead of the normal 3 to 4. And the reason why we do so many boosters in young kittens is because we don't know when their maternal antibodies wear off. Kittens get maternal antibodies from colostrum from their mother cat, which is great because it protects them from infectious disease. The only drawback is that it interferes with the vaccine effectiveness because the antibodies in the colostrum recognize the foreign invaders in a vaccine and destroy it. So by the time a kitten is 4 months old, all of those maternal antibodies have been worn off, and your kitten only needs 2 doses of most of the vaccines except for rabies, and they only need 1. So it's never too late. Good question. Here is a question, somebody who is Michael. Hello, my friend. You are a beautiful, proactive pet owner. I wish more people would think about this. these kind of questions before they get a cat. So this person wants to get a cat, but they work 8 hours a day. How can I keep my cat from getting depressed? Are toys enough? Wonderful question. So you are going to want to investigate all things environmental enrichment. Environmental enrichment. That is where you make the cat's space calm and mentally stimulating. And there's lots of different ways to do it. Toys are often great, but they may not be enough if your cat isn't an active player. If you are thinking about getting a Siamese and you haven't gotten one yet, maybe you could this is the one case where maybe getting 2 kittens from the same litter would be a good way to help these kittens have company when you're not around. Other things you could do, hire a pet sitter to come in once a day or once a day and play with the cat. There are things like no bowl feeders. Google no bowl feeders and food puzzles, which are wonderfully mentally stimulating ways to get cats to use their brains to figure out how to get their food. And that can often keep them entertained for a long time. Some people will subscribe to cat channels on their TV where they can leave it running all day and the cat can watch TV. So there are different options, but I do think that you are smart to think about a cat being alone for 8 hours a day. Now, there's lots of cats that don't mind being alone for 8 hours a day, but there is always a potential that your cat could get depressed if they're alone that much without enough enrichment. So think about enrichment. Think about getting 2 cats at the same time, because this would be the one time that I think it'd probably be a good idea, and go from there. Okay. Okay, here we go. Well, this is very technical. What do I think about niacinamide to lower blood pressure in cats with kidney failure? I don't know. Oh, not blood pressure, phosphorus, right? Phosphorus, it's a phosphate binder in cats. So I am doing a little research for you guys. I think there is research that is coming out. So niacinamide is it's a form of B vitamin, right? And they're finding that it is another way to lower phosphorus levels. So one of the problems in cats with kidney failure is their kidneys cannot filter phosphorus correctly, and so it builds up in their blood, and they basically start turning to stone. So what we used to do is we used to use phosphate binders, like aluminum or calcium, which would bind phosphorus in the gut. But niacinamide has been blocking portions of phosphorus uptake. So from 2005 to 2017, there was about 10 studies of niacinamide being used in humans. And so I'm looking to see, did you see I'm reading? I'm reading right now. So they have not, I don't know if I've found any studies in cats. Aluminum hydroxide is the binder that they used to use. Oh. And we do use it to treat inflammatory skin conditions. Do you see I'm still looking this up for you? So there was a study in 2018 that found, so the main problem with these phosphorus binders in cats is constipation, obviously. And so we're looking for a new way. And I have not used it yet. And honestly, I would want to, before I actually answered this question, I would actually want to do some research for you. So if you can do me a favor and you can go to the All About Cats forum, and if you can leave a question there in the healthcare section, I will do a little bit of research because I don't want to take any more of our time. We've only got 8 minutes left together. So if you go and you bring me a question, then I can answer it because I am not going to take any more time to research that right now. Okay. All right. I'm still looking through all of these. Okay. This is a cute question. I like this one. Bart the cat meows to announce he's used his litter box. Number 1 and number 2. 6 years old, neutered male, rescued about a year ago. He's 90%. He was 90% outdoor, now 90% indoor, out on a leash. You are awesome. Should you worry? I would say if it looks like he's agitated when he's leaving the litter box, or if he is going to the litter box frequently and only producing small amounts of urine, or if he's sitting in the litter box and you ever see any bloody urine, or if he runs out of the litter box quickly after he does his thing and is yowling at the same time, then that could be signs of inflammation. But if it's just his behavior to just meow after he does that, then I wouldn't worry. If you are worried, get a urine sample and have it checked out by your local veterinarian. Okay? Oh no. Okay. My cat urinates in the litter box and right after she poops out of the litter box. Ugh, frustrating, right? Any tips? So first tip off the top of my head, add a second box. Add a second box right next to the first box. Another tip is if it's right outside of the litter box, you could put a tray, or you could put a paper liner down. There's something inside this cat's brain that makes them think that they need to go someplace else to do number 2. And so providing them a secondary place to do that, maybe another box, see if that helps. Okay. All right. Okie dokie. Why does my 14-year-old female indoor cat eat all the fur off her belly? It's only my husband and there are no kids aggravating her. Well, there's something bothering her, Miss Rebecca. So we don't know what it is. Maybe it's the husband. It's always the husband, right? No, I'm just telling jokes. So there's something else going on. So maybe it could be some sort of problem in the household that is stressing the cat out. When cats eat off all the fur off their belly, there's something stressing the cat out. It could be something in the external environment. It could be something in the cat's body. At the age of 14, that would that's a decent age on a cat. I would make sure there isn't any other medical underlying problems going on. I would also talk to your vet about anxiety medicine. hmm Gabapentin, I'm telling you, it covers a whole multitude of evils. And then I would also investigate things like calming aids, or prevention, like the thunder shirt I talked about, or putting a t-shirt on that cat. But definitely that cat is sending you a message that she is not happy about something. And Google stress in cats, because you'd be surprised at what stresses cats out. Other cats stress cats out. Changes in routine, any renovating, moving furniture, changing the food, people coming into the house, people leaving the house, stray cats in the neighborhood, heavy scents, heavy scented candles. I mean, the list goes on and on and on. So I think you're going to need to do a little bit more investigative. Also, make sure you get a clean bill of health from your vet. I mean, it could be arthritis at this point. And a 14-year-old cat, there's probably some arthritis going on. Do we need to do a trial with some pain meds? Right? This is how I would have these conversations with my clients. So that is the thing. You've got a signal from your cat. Now it's time to do some investigation. Here is a question about standard vaccines for cats. Because this person has not had any vaccines for their cat. So in the States, again, I'm in the United States. So here is what we do here. Standard procedure. What we tend to vaccinate cats for is rabies, right? And then we tend to do a combo vaccine called FVRCP. And there's a whole bunch in there. There's panleukopenia, there's virus, there's feline rhinotracheosis. There's a lot, right? Those are the two. Those are the two vaccines that tend to be given to most cats. And then there is other vaccinations. There's the feline leukemia vaccine, and some people get that vaccine and some don't. If your cat goes outdoors all the time, it's a good idea. If your cat is indoor only, I wouldn't do it. What I used to say to people who were considering whether to get the leukemia vaccine or not, I was like, well, is there a chance your cat may ever go outside? And they're like, well, it could happen. I'm like, well, why don't we do it this year? And then we can reevaluate next year. So those are the standard vaccines in cats. All right, we got 2 minutes. Oh, I'm so sorry. Okay, hold on. Okay, here's a question. We talked about how cats can heal themselves, right? So this cat has a dislocated toe, and the veterinarian told this lovely person to keep their cats confined in a small room for the next 3 weeks until there's availability to do an x-ray. Do you have to wait 3 weeks to get an x-ray? I am so sorry. I don't even know what's going on with humans right now. So I would suggest, if you haven't had an x-ray yet, to call around and get an x-ray from another vet. Hopefully you can find somebody. If not, and you keep the cat in the small room for 3 weeks, it is highly likely that that cat will heal himself. I have seen it happen over and over and over. I have seen cats with broken pelvises where the owner could not afford to have surgery done, and they kept the cat in a crate, and the animal healed itself. So there's a high likelihood that your cat can heal itself. It just happens. But in the meantime, you probably want to know what's going on. So I would recommend getting an x-ray from somebody else sooner if you can. Because in 3 weeks, there's going to be a lot of changes in that toe. And we won't know whether it's gotten better or if it's gotten worse if we don't have what we call a baseline x-ray. So you need to have one now so that you can compare it in 3 weeks. So hopefully that answers your question. Oh, hello. Hello from Barcelona. Oh, my friend. Okay. Oh, my friends. It is that time again. So I have not been able to get to all of your questions, but I love this time that we spend together, and I'm so grateful. And I know that you guys have many more questions, so I would recommend popping on over to the All About Cats forum. There's a forum in there, and there's a place where you can ask questions, and there is veterinarians that are hanging out that would love to answer questions. So if I didn't get to it today, you can try that. Alternatively, I will be back again next month, and I'm going to do this again and answer as many questions as I can. So I apologize if I did not get to your question. I am so grateful for all the time that you guys give me. You give me an hour of your time, and for all of these beautiful, conscientious questions you're asking about how to be a better cat parent. So the other nice thing about All About Cats, there's a ton of articles and there's videos and there's all kinds of resources for you there. So pop on over, check it out. And thank you again for all of your questions. And I will see you guys next month. Okay.